Hello everyone, I will be presenting on Legionnaire's disease. So in 1976, a mysterious outbreak of severe pneumonia occurred in Philadelphia at the American Legion Convention. After months of investigation, a previously undiscovered bacteria was found to be the cause of the outbreak. The bacteria was named Legionella and the disease Legionnaire's disease. What's interesting is during that outbreak investigation and after it was completed, the investigators discovered that the Legionella bacteria was also responsible for Pontiac fever, which first occurred in 1968. So legionellosis is a broad term given to any disease or illness caused by Legionella bacteria, and Legionnaire's disease and Pontiac fever would fall under this broad category. So now a little bit about the Legionella bacteria themselves. So in the upper right corner, I have a picture of the bacteria in the lung. So Legionella are a gram-negative bacillus bacteria found in natural and artificial water environments. So Legionella survive by using 14 different species of protozoa as vectors and for protection. I found it interesting that the Legionella bacteria can infect protozoa, specifically amoebas, which are parasites, and then they incubate and multiply within these amoebas. What's really interesting is they actually end up killing the amoeba, but the bacteria survives, and it's at a much greater number than it was before. Legionella can also live and grow in biofilm, which I have depicted in an image in the upper left corner on the screen. So the bacteria only causes diseases in artificial water systems, and that's because when the water is between 20 degrees Celsius and 45 degrees Celsius, the bacteria thrives. You can be in a pond infected with Legionella bacteria, but you won't get Legionnaire's disease. Yet, if you are in contact with an air conditioner that is contaminated with Legionella, you will or can get Legionnaire's disease. There are over 50 species of Legionella bacteria and 70 serotypes. The most common species and the one that causes Legionnaire's disease is L. pneumophilia. The incubation period is 2 to 10 days. Legionnaire's disease symptoms are often non-specific, so without a diagnostic test, it is impossible to differentiate Legionnaire's disease from other types of pneumonia. So by diagnostic test, I mean a microbiological test, such as a urine test or testing the sputum from the lung, because the chest x-rays are indistinguishable from each other. So on the right, I have a picture of the common symptoms of Legionnaire's disease. So headache, fever, chills, ataxia, tiredness, nausea, diarrhea, vomiting, cough, and shortness of breath, muscle aches. So other symptoms can include confusion, delirium, pleural effusion, and renal failure, which is kidney failure. So risk factors include being over the age of 50, being male, smoking, diabetes, lung cancer, having a recent organ transplant, or HIV/AIDS. Basically, if someone is immunocompromised, they are at a greater risk of developing Legionnaire's disease. What's interesting is that for every one female patient, there is 1.4 to 4.3 male patients. And then the treatment for Legionnaire's disease is just different antibiotics. Okay. So the burden of the disease. Legionnaire's disease is believed to be underdiagnosed and significantly underreported. The assumption is that not every case of pneumonia is going under the microbiological test to determine if it is Legionnaire's disease versus another kind of pneumonia. So it is estimated that 2 to 5% of all pneumonia cases are caused by Legionella bacteria and are actually Legionnaire's disease. So in 2018, Canada reported more than 600 cases. The USA reported 10,000 cases, and Europe as a whole reported an average of 2.2 cases per 100,000 people. 2018 was the most recent numbers I could find. And again, these numbers are likely quite lower than they actually are. So case fatality rate is actually quite high. So in community-acquired cases, the mortality rate is 20%, so about 1 in 5 people. And for hospital-acquired cases, case fatality rate is 40%, so 2 in 5. 2 in 5 people. Transmission. So Legionnaire's disease is transmitted via aerosols. So you would inhale the contaminated water particles. Any device that creates water aerosols can transmit the disease. What's really interesting is there are records of infections occurring up to 3.2 kilometers away from the source. So when they were investigating the outbreak in 1976, there were cases of Legionnaire's disease where the people did not interact with the hotel or the air conditioning system. They weren't at the convention, staying at the hotel. They were across the street and walked by, or they walked by the hotel itself. So that's just an example of where they first learned that the disease can be infectious for quite some distance. Sources can include cooling towers, hot tubs, potable water systems, which are basically safe drinking water systems, decorative fountains, humidifiers, grocery store misters, whirlpool spas, air conditioners, and potting soil mixes. So on the right, I have an image of the 4 most common sources. So you have the hot tub, the shower representing potable water systems, a decorative fountain, and a cooling tower. And it shows them infecting the high-risk groups for this disease. Respiratory equipment, such as nebulizers, are possible sources of transmission in hospitals. And if someone in the hospital has recently been incubated or undergone aspiration, they are at higher risk of acquiring Legionnaire's disease if the Legionella bacteria are present in these systems. So 62% of outbreaks occur in summer and early fall, suggesting that there is some seasonal pattern to the infection. Prevention. There is no vaccine available. Legionnaire's disease primary prevention strategy is routine maintenance and surveillance of man-made water systems. So according to this image I have on the right, 9 in 10 CDC investigations show almost all outbreaks were caused by problems preventable with more effective water management. That is significant. That means 90% of the outbreaks recorded by the USA CDC, so that's just in the US, could have been prevented by basic and effective water management. Adopting and following guidelines for regular maintenance and disinfection protocols is recommended for all aerosol generating devices, whether in the community or hospital settings. The improper cleaning of the sediment and biofilm can liberate Legionella. Therefore, cleaning and disinfection should be done simultaneously. The development of effective water safety plans is also important. So disinfection can be primary or secondary prevention. It would be primary prevention when it's a part of routine maintenance. It would be secondary prevention when you disinfect after detection of Legionella bacteria from environmental surveillance or after an outbreak has occurred. So there are many different ways to disinfect systems. Here are a few. So thermal eradication, which is heating up the water to above 50 degrees Celsius, where it will kill the bacteria, and then flushing it out of the system. Copper and silver ionization is an option, however, it's not safe for drinking water systems. So you won't see it a lot in hospitals or community settings. Ultraviolet light radiation. It does not eradicate the Legionella if the bacteria is already in the system. So the ultraviolet light irradiation is only for primary prevention. Once that bacteria has taken hold in the system, it is no longer an option because it won't be effective. So there would be no point in using it. Hyperchlorination. So chlorine is the most effective biocide against Legionella. However, it can be corrosive on the pipes if used incorrectly or too much. While chlorine can be used for long-term prevention or outbreaks, hyperchlorination can cause shock and damage to the system, allowing for recontamination to occur quickly. So hyperchlorination is basically putting lots of chlorine into the system pretty quickly, and it's done through a machine, and it does need to be monitored closely by a professional. This can lead to bacteria building up a resistance to biocides, which is not an ideal. We really don't want that to happen. And high levels of chlorine in the water from hyperchlorination can cause health problems. This is just a nice infographic created by the Alliance to Prevent Legionnaires' disease, and it shows the lines of prevention. So it talks about education, source of water treatment, public water distribution systems, building the water systems, the water equipment management, investigation protocol, and ongoing research. So surveillance. Legionnaires is a notifiable disease in many countries. However, as previously stated, because it is believed to be underreported, there is not an accurate picture for surveillance. All outbreaks are common source outbreaks. A case is confirmed once Legionella bacteria has been isolated in a sample by the lab, and a probable case is somewhat epidemiologically linked to a confirmed case. For surveillance purposes, the cases are grouped into 3 categories: community acquired, hospital acquired, and travel acquired. Travel acquired cases can be more challenging to track, and some countries have separate surveillance systems for travel associated outbreaks. Just because you have a surveillance system for a disease, or even like Legionnaire's disease, does not mean you are equipped to handle surveillance of travel-associated outbreaks. For example, the USA has 2 national surveillance systems for Legionnaire's disease, yet neither can detect clusters of travel-acquired cases. Risk communication. The creation of water safety plans with the assistance of stakeholders is very important. Water safety plans would differ based on the system and the location's needs. For example, cooling towers, cruise ships, and hospitals would all have different water safety plans and concerns. Risk communication is the step after risk management. And it is important that when communicating the risks, the information is easy to understand. While these water safety plans would be tailored to specific professions and locations, it is important to have a public plan for personal water safety like hot tubs and air conditioners. I suggest that when sharing these plans and procedures with consumers, it may be helpful to email reminders to check and clean their systems yearly, aside from the information available on the product website or local government websites, such as the CDC or Alberta Health Services. Operating on the assumption that it is easy to forget to perform regular maintenance, especially in unregulated environments such as the home, having reminders can be an important aspect of risk communication to help prevent Legionella infection and Legionnaire's disease. People may believe that Legionnaire's disease is not a concern because the number of cases is not as high as some other diseases. However, even when considering the underreporting of Legionnaire's disease, the case fatality rate is significant, especially in hospital-acquired cases where we already have immunocompromised patients. That is why risk communication on the infrastructure level, like hospitals, hotels, ships, cooling towers, and businesses, is important to protect the public from infection. So I labeled this slide future needs, and it's a little bit of a conclusion, but also 4 things I think that need to be researched more. So firstly, policies that guide and require the management and disinfection of water systems are important to prevent or limit the spread. More detailed surveillance systems, especially for travel-acquired infections, will be crucial for improving surveillance and outbreak management in the future. As more Legionella species keep being identified, guidelines and prevention may need to expand to include other species and serotypes of Legionella. More research can be conducted into understanding the viral load required for Legionella to cause disease and how far the disease can be transmitted. From the literature, it is still unclear what the viral load required to cause Legionnaire's disease is, and there is still no understanding of how far the disease can spread, besides the assumption that the viral load, the amount of the viral load predicts how far it can spread, which knowing how far the disease can possibly spread could be very important for surveillance and outbreak management. Thank you, and I hope you guys have a great weekend.